Okay.
But we're
Now
host again.
we're host again. I'm gonna make you the co-host.
Okay, cool. I was before. I don't know what happened.
Yeah.
If you come back,
You are.
Okay.
okay.
We're all back. Awesome.
We're only missing 6 people we had originally, but let's just power through. And then Angela from SourceWise, I made you the co-host so you can share your screen.
Okay.
Thank you so much. Sorry, guys.
Why can't I started over?
Oh, yeah.
Is it on again?
Yes.
Is everyone able to see my presentation?
No, not yet. Perfect. That's funny.
Okay. How about now?
Yes, we can.
Okay. Great. So hi, everybody. Another Angela here. I'm a community resource specialist at SourceWise. Throughout this presentation, who SourceWise is, what services we offer, our network, how to connect with us, and how to support us and your community. So to begin, our mission is to provide adults and their caregivers the tools and services they need to effectively navigate their health and life options. Through a comprehensive network of resources, SourceWise strives to educate, prepare, support, and advocate for all adults, their families, and caregivers within Santa Clara County. We provide education, expertise, and quality support services. We're your local organization to turn to for community resources. At a national level, the Administration on Community Living enables the development of services and opportunities for older adults, individuals with disabilities, and caregivers. One detail we're very proud of is that SourceWise is a 501c3 nonprofit organization, of which there are only 6 in California. In 2013, we began to serve all adults over the age of 18, but I want to emphasize that we continue to focus on serving seniors and caregivers. We offer programs providing direct services that are information and awareness, health insurance counseling and advocacy program, Meals on Wheels, senior employment services, care management, family caregiver support program, and public authority services. During this time of physical distancing, our team members are dedicated to staying connected and providing access to services to clients by phone, email, and virtually. So callers often don't know where to begin. We advise calling our main line and pressing option 1, or you can email us at community@mysourcewise.com. You'll then be connected to a community resource specialist who will provide a list of customized referrals, as well as eligibility criteria, service area availability, necessary processes, and applications. Information and Awareness, the program I'm from, has access to a directory of resources available throughout Santa Clara County. Referral information is provided via phone, email, or mail. Community resource specialists are the best place to start your search for assistance. In fiscal year 2019 to 2020, Information and Awareness helped 57,569 clients. Professional interpretation services are also available if needed. We'll help you connect to experts and other services. Our phone menu will be explained throughout this presentation. Next up is our Meals on Wheels program. So this program is for homebound adults aged 60 years and older. Clients will receive 14 meals consisting of 7 frozen entrees, 7 breakfast items, a half of a gallon of 2% milk, fruit juice, and dessert items. SourceWise is able to offer this great service through donations from our community and clients' help. Clients are encouraged to donate $1.80 per day, but nobody will ever be denied a meals if they're not able to contribute all or a portion of the suggested contribution. You can complete the intake and eligibility form on our website for you or a loved one. Within 2 business days, you'll receive a call from a nutrition coordinator confirming eligibility and when you should be receiving your first meal. If you're not eligible, you'll still receive a call and will be provided additional resources that you might be eligible for. Visit mysourcewise.com today. In partnership with the City of San Jose, SourceWise brings you San Jose Together Meals on Wheels. This is an essential emergency response expansion of our Meals on Wheels program that brings nutrition right to your door. Initial eligibility and intake are completed by phone with a SourceWise nutrition coordinator. Clients of the program receive meals that are delivered once a week, consisting of 14 meals, just as our Meals on Wheels program does. This program is set to run until March 31st, 2021. The Great Plates Delivered Restaurant program is another new nutrition program that started due to the pandemic. It supports adults over the age of 65 or age 60 to 64 who are considered to be high risk for COVID-19. It encourages staying home by delivering 2 nutritious meals 5 days a week. Since April 2020, the Great Plates Delivered Restaurant program has served 295,750 meals and up to 1,683 clients. This program is set to run through March 8th, 2021. Our Senior Employment Services program encourages clients to get back into the workforce. Eligibility qualifications are that you must be age 55 or older, unemployed and able to work, a Santa Clara County resident, and meet household low-income guidelines. During this time of physical distancing, participants are on emergency paid sick leave and are not permitted to work until further notice. To be eligible for senior employment services, your total household income must not exceed 125% of the federal poverty guidelines. In care management, we have our multi-purpose senior services program that is meant to avoid premature placement of persons in nursing facilities while fostering independent living in the community. MSSP is authorized to serve up to 375 clients per month. Getting started includes having an initial phone screening, interview, in-home assessment, and then care plan development. MSSP has a current wait list of 15 days, depending on the risk level needed of the client. Enrollment processes includes an initial phone screening. Sorry about that. Our caregivers network. So we have a family caregiver support program, which provides temporary respite to caregivers and to determine other support services available. In fiscal year 2019 to 2020, we served 65 individuals. Respite may include in-home, daycare, and out of home. The enrollment process is similar as it includes an initial phone screening, interview, in-home assessment, and care plan development. Caregivers Network has no waiting list. Now for Public Authority Services by SourceWise. This program utilizes technology and experience to support seniors and persons with disabilities by providing access to pre-screened in-home supportive services, training, administration of benefits, and enrollment processing. To qualify, the care recipient needs to be on Medi-Cal. The IHSS program is designed to assist elderly, blind, and persons with disabilities to remain in their home when they can no longer care for themselves. Public Authority Services provides continuous training and augmenting the quality of care providers through improved screening and matching processes, which is possible through innovative technology. During this time of physical distancing, clear communication with our clients and community members is more important now so more than ever. IHSS care providers and provider benefits are offered remotely during the COVID-19 pandemic. This concludes our direct services, and now I'll share the shared network of resources that we support. SourceWise works with local service providers to ensure services are available in our community. We network with 11 grantees to provide critical services. In fiscal year 2020 to 2021, these are the categories of services funded throughout Santa Clara County: adult daycare, caregiver education, caregiver resources, caregiver training, care management, disease prevention and health promotion, elder protection, and health and nutrition. SourceWise funds programs within each of the organizations you see listed here. When you call SourceWise, our aim is to ensure the support you're looking for is received, whether provided directly with one of our programs or from other community-based organizations. We always do our best to find options that are available to you. We produce a quarterly newsletter that serves as an opportunity to receive information that's important for seniors and caregivers in Santa Clara County. Topics included are important federal, state, and local news, SourceWise program updates, healthcare news, and caregiver help. You may use the contact information above to subscribe to our quarterly newsletter if interested. Our Resource Connection offers a directory of resources. To begin your search, you can filter by zip code, age, gender, and language. Then you can search by category, name, and keyword. If you believe that an organization not listed may benefit our community members, contact us. You can call us or email us. From July 1st through June 30th, 2020, SourceWise helped a total of 100,235 seniors, caregivers, and individuals with disabilities. If you would like to help SourceWise continue to provide services that are essential for senior and community members, there's a few different ways you can help us. We have volunteer opportunities available for any age and interests. If interested in volunteering, email community@mysourcewise.com or visit our website to get a volunteer application. If you would like to make a monetary donation, every dollar truly counts. You can donate on our website or send checks payable to SourceWise. Thank you for your time and attention today. I'd be happy to answer any questions you may have before my colleague Stephen takes it away to speak on our health insurance counseling and advocacy program. Are there any questions?
Looks like you got a question in the chat box, Angela. The question is, do you currently have resources for transportation aid?
Yes, we have transportation resources. The best way to access these would be by contacting a community resource specialist, either by phone with the 350 number you see listed, or by email with the email community@mysourcewise.com.
There's another question in the chat box. It says, do you have resources for households impacted by COVID for paying rent, for example?
Yes, we do have some resources for rental payment assistance as well as utility assistance.
I have a question.
Sure.
I don't know if you mentioned it, but is there any like limit on how many people we can refer, or how many clients are you guys able to take on at the time?
No, we are not limited by any number of clients, so you can refer as many people as needed. Some programs do have wait lists, like our multi-purpose senior services program, which I mentioned, there's a wait list of 15 days. And if our family caregiver support program, if there is too many people, there could be a wait list, but as of now, there's no wait list with that program.
Awesome. Really good resource. Thank you so much.
Of course.
Could you tell us more about the rent and utility assistance that you mentioned?
Sure. So there are some rental and utility assistant resources available in Santa Clara County. They do ask for some documentation such as your current address, some proof of income, identification, but that's all subject to the specific resource. So I recommend, if interested in referring any of your clients to us, start by calling the 350-3200 number, pressing option 1 to speak with a community resource specialist, and they'll be able to connect you with some of those resources.
Just to clarify, you would be, if we do that, then you would connect the client to the resource. This is not something that you do internal. It's like.
Correct. Correct. We would connect you to the resource in Santa Clara County. We don't do that internally.
So for stuff like that, are you kind of like a 211?
In a sense, where we offer resources in our community, yes. We do have internal programs as well. So if you call needing Medicare counseling, we can refer you to our internal program of health insurance counseling and advocacy. But if you're needing a resource that is outside of SourceWise, such as rental assistance, then we would connect you to resources in our community.
Okay, thank you.
You're welcome.
Angela, I had one more question. I serve a lot of homeless clients that are above the age of 65. How do your programs like work with individuals that are experiencing homelessness? Can they still get the meal delivery? Can they deliver it to an encampment or like a street corner?
So I believe they can deliver to an encampment if perhaps they would be able to offer a local address they can meet them at. For homelessness resources, we do have shelters as well as case management resources as well.
Oh, I didn't know that. Awesome. Cool. Thanks.
You're welcome.
Awesome. So if anyone has any other questions, please pop them in the chat box. And then Angela, if you can just monitor that and answer maybe any as they come up. Thank you so much for your presentation. Let's move on to Stephen, also with SourceWise from the Health Insurance Counseling and Advocacy Program, I think, but he'll tell you all about it. So, all right. Are you able to share your screen, Stephen?
As of right now, I am not. So I'll try.
I think you are now. Give it a
Co-host.
try.
Now. Okay, does that look okay, everybody?
Yep, you're good.
Okay, well, thank you, Angela, for doing a lot of the describing of SourceWise services. My name's Stephen Rubacaba, and I work with the Health Insurance Counseling and Advocacy Program, which, yes, it's a lot to say. We're commonly referred to as HICAP across the state of California. And the main goal, or one of our objectives, is to provide one-on-one counseling for Medicare beneficiaries, their families and caregivers. And we essentially want them to understand some of their healthcare options. I mean, Medicare, before I started working in this program, I was like, oh, Medicare, once we turn 65, everything is completely taken care of. But that wasn't the case. So our HICAP counselors are all trained and certified by the state of California. We have HICAP staff members, but we mainly survive by our HICAP volunteers. So we do one-on-one counseling appointments. We also do a lot of outreach in the community. That's actually my main function here in HICAP. And the outreach services, well, pre-COVID, it was very, very much different, and our counseling looked and felt a whole lot different. But we typically have representation all around the county, various community centers, senior centers, even some of our health centers where our counselors are stationed at and do their one-on-one counseling at these various sites for easy access across the county. And, you know, obviously with sheltering in place, there's been a whole lot of revamping and changes on that. So, most of our counseling now, to make sure we're keeping everybody safe, is all done in a remote capacity, whether it be over the phone, over the telephone. We also do, for those that can do it, Microsoft Teams virtual counseling. There is no in-person counseling yet. To be honest, I'm quite unsure when it's going to resume. But when it does, I'm looking forward to it, to actually seeing folks and interacting. It does take our counseling sessions a whole lot longer. There's a lot that's missing from our in-person counseling, a lot of nonverbal cues, just noticing if someone is agreeing with us, but they look, like they're not understanding. So I'm very excited to get back out into the community safely to make sure we're able to be there for our Medicare beneficiaries. So again, HICAP, we are a part of the State Health Insurance Assistance Program, is what it's known as nationally. And on a more local level, or on California level, California likes to do things a lot differently than the rest of the states. So in California, it's called HICAP, and it can be named slightly differently in various other states. I think Washington State is called SHIBA, which is an acronym, and a couple of other states have some interesting acronyms, but we are all known as the State Health Insurance Assistance Program. And by all means, feel free to give us a call for any one-on-one counseling appointment. Our number's above, 408-350-3200. Option number 2 is going to get you to our HICAP program. And again, I know a lot of folks here are on the border of Santa Clara County and maybe San Mateo County. So if you do know of anybody who needs HICAP assistance, any other county can contact the 800-434-0222 telephone number. That number will automatically route folks based on their area code to the appropriate county. But if someone has a 408 area code and is living in another county, it may route them back to me, which I'll certainly give them the direct number. But that's the state number in case you need to get folks in a different county. For people that are out of state, if you somehow cross paths with, I know I do, there is a website for those individuals to gain access to the local SHIP program. Again, the local SHIP programs give free, objective, and unbiased Medicare counseling. We don't work for or represent any insurance company or any insurance agent. Again, our main goal is to give objective information. We're not trying to peddle or sell any type of insurance products. So again, HICAP, our main scope of work is assisting Medicare beneficiaries. And Medicare, it's a federal insurance program for citizens that are citizens or 5-year permanent residents that are typically 65 years or older. If you're younger than 65 with specific disabilities per Social Security Administration, you may also become eligible for Medicare. Or you could be at any age with end-stage renal disease or kidney failure. You'll also become eligible for Medicare. And by the way, Medicare is issued by the Center for Medicare and Medicaid Services, or CMS. So it's all managed by the federal government. And just to give a brief high level of what Medicare is, and by the way, it came about back in the 60s. So there are pretty much 2 paths for people on Medicare, and those 2 paths, they have 2 options. They can stick with original Medicare. You probably heard of Part A, Part B. So our Part A Medicare insurance covers all of our hospital care. So, if we get hospitalized or we have to be in a skilled nursing facility, home health care, hospice care, that's all covered by Part A insurance. Our Part B, like boy, is essentially the medical insurance. So our outpatient care, physician services, preventative services, diagnostic tests, therapies, even our durable medical equipment, wheelchair, walking cane, grab bar, these types of things. So that's kind of what the original Medicare is. And oftentimes, Part A only covers 80%. And us as Medicare beneficiaries are obligated to pay the remaining 20%. Now, 20% of a hospital bill can be gravely expensive for any one of us. So that's where these Medigaps or supplemental plans kind of step in. So they fill those gaps They're all sold by private insurance companies, mind you. They are standardized by the federal government, so which means, you know, one Medigap plan pays for these services. That means every single Medigap plan will cover and pay for those services. And then finally, to make sure that we're fully covered, we also have our Part D, like drug plans, which are also sold by private insurance companies, and they cover our prescription drugs. That's kind of the original route to handle our Medicare benefits. The other option that folks can try is the Medicare Advantage route, which the easiest way I could explain a Medicare Advantage plan to you folks here today is it functions almost just like an HMO plan that perhaps you and I have right now from our employer. So we have to stay in a network. You know, we cannot just go wherever we want to in the country that takes Medicare, which original Medicare, the biggest difference is it's flexible. You can go anywhere in the country that takes Medicare benefits, see a specialist wherever you want to. You don't have to get approval. You just go, make your appointment, take care of business. Medicare Advantage is the complete opposite. You have a primary care physician that you must get approval from if you want to venture outside of that network, perhaps see a specialist in another state or outside of their network. And almost every single Medicare Advantage plan in our county, Santa Clara County, all includes drug coverage. So it's kind of like a one-stop shop, which can be very enticing to people. And they're also able to add on some extra, I'll call them sweeteners. You know, they can give some extra benefits like some over-the-counter funds. You know, they can get a fixed amount of money for over-the-counter meds. They can get free gym memberships sometimes. Sometimes they can get transportation to and from their medical appointments. And again, Medicare Advantage plans, they're all sold by private insurance companies. You know, one of the big players around here is Kaiser, Stanford, they have Medicare Advantage plans. So they're all sold privately. And some general questions that HICAP answers all day, every day for folks. And again, most of the questions we're answering are for people that are about to enter the world of Medicare, so just about to turn 65. Maybe they're older than 65, they're still working, covered by their group health plan, and they don't need Medicare quite yet, but they're thinking about retiring. We answer those types of questions. Or maybe they've been on Medicare and they're thinking about changing up their healthcare coverage. So we answer questions on original Medicare, Medicare supplement or Medigap insurance plans, Medicare Advantage plans. Right now in our county, good grief, there's 50 something, I think there's 55 Medicare Advantage plans just in Santa Clara County. So it's nice to have a lot of choice, although it can be a bit overwhelming when we're sifting through all these options and choices and all the detailed differences. We also answer a lot of questions about Part D or Medicare prescription drug coverage. In our county, there's 32 different options. And there's even plans that work with people or programs that are limited on income. So there's a handful of programs out there that can help absorb some of those Medicare out-of-pocket costs, you know, co-pays, premiums. There are also unique choices for dual eligible folks, you know, dual eligibles or Medis, you know, Medicare and Medi-Cal eligible. They do coordinate together, which is nice. But again, there are extra rights with folks that are on Medi-Cal and Medicare. So they have additional flexibility. And obviously, again, you know, they subsidize and help pay for a lot of the Medicare out-of-pocket costs. And obviously, you know, we do a lot of Medicare counseling on coordination with other insurances. Like, again, if I'm Medicare eligible, but I have a group health plan, I can, there's a lot of folks that want to know how that transition works, timing of when to enroll in certain Medicare products. There are certain time limits that we must enroll or else we might get hit with late enrollment penalties. We even know how Medicare coordinates with a lot of the retiree plans that are around in our county. We also counsel folks that are interested in, well, that are needing to look into long-term care insurance. And we also have our own, so all HICAPs have a senior Medicare patrol, which is essentially a liaison between, law enforcement and folks that may be experiencing some fraudulent activity. Now, let me just share something briefly about fraud in Medicare. It's a gross amount of fraudulent activity that goes on. The estimate of annual losses due to Medicare fraud is in the billions. It's estimated to be between 50 and 60 billion. That's 50 and 60 billion dollars that is coming out and being defrauded out of the Medicare program that we're all paying into. And one of the more popular ones that's coming out, well, we're doing a lot of senior Medicare Patrol COVID vaccine scam presentations, or just COVID scams related to Medicare. And I'll just briefly let y'all know today, I'm not going to dwell too much on fraud and Medicare, but some of the popular ones that are going on right now, sad to say, are with the COVID-19 vaccines. So, there's a lot of scamsters out there trying to get their hands on our Medicare number, trying to get their hands on our social security number, bank account, credit card information. So if you can share with any of your clients that are talking about this, it's not just for Medicare folk, it's for everybody. We cannot pay to put our name on any kind of vaccine list. That's a scam. We can't pay to get any type of early access to the vaccine. That's also a scam. And let's be honest, nobody legitimate is going to call us asking for our social security, bank account, Medicare information. It's almost never happens that Medicare, someone from Medicare, a legitimate representative, or someone from Social Security Administration is going to reach out and call us and ask us for some of this personal identifying information. They typically put everything in writing and mail it out to us. So please, I'm sure you all know about these things, but it's nice to remind our clientele about some of these nasty scams that are floating around. But anyways, I won't dwell too much about this, but I do feel it's appropriate to mention Medicare fraud and that it's very rampant all the time, and it's especially nasty when we're dealing with some kind of pandemic like we're all dealing with now. So on a high level, without taking up everybody's morning, that's essentially in a nutshell what HICAPs do in our county, across the state, and SHIPs do across the nation. For Santa Clara County residents, I do encourage you to give us a holler for an appointment, 408-350-3200, option number 2, and you'll get our HICAP staff. Feel free to leave a voicemail if we don't answer. I know we are answering live calls on occasion. I know I certainly am. So feel free to reach out. We'll definitely call and answer all your questions. If I'm not the one to answer your question, well, let me just share. We return every single message, even if it's the wrong number. If someone leaves a voicemail for some other organization, or it's just, they're way off, we all are certainly going to call you back. And if we don't have the answer ourselves, we'll make certain that that we point you in the right direction to the appropriate resource. So please give us a holler for any Medicare related counseling or questions. Otherwise, you can visit mysourcewise.com. There's some frequently asked questions related to HICAP. Other counties, again, the telephone number's there. Other than that, I think I covered most bases I wanted to cover, but I'm certain I missed something. But now is a good time for anybody here this morning. If you have any questions, feel free to reach out, chat. I know I've kind of been neglecting the chat. I'm awful at multitasking. Let me see if I can review.
Stephen, it looks like there's only one question in the chat so far, and it says, what's the age range you serve?
Well, the age range HICAP serves, to be very clear, we serve anybody on Medicare, anybody about to enter the world of Medicare. Primarily, folks are eligible for Medicare when we turn 65, or again, we can be Medicare eligible at any age if we have end-stage renal disease or various diagnoses that Social Security Administration says, oh, this person's eligible for Medicare. But source-wise, as a whole, we help any aging adult 18 and up. Hope that answers the question. Okay, I like it. Nice and easy. One easy softball question. Is there anything else? I know I may have been speaking a little quickly. I do apologize. But I'll certainly make sure that y'all get the PowerPoint slide deck via PDF, and I also have some pretty helpful and educational or informative multi-language high-cap brochures and flyers that I'd be glad um, to send out to everybody, or send to the organizers and hosts, and perhaps forward out to everybody, because I mean, Medicare, again, it's crazy complex, and the questions I get asked every day, you know, they're kind of, well, me, since I know a lot now, you know, they seem like easy questions that I thought I knew the answer to before I started working here, but you know, it's so complicated, and we do have so many options, and we do have protections once we are Medicare eligible. California has added protections for Medicare beneficiaries, and again, we answer a lot of questions for people that are Medicare, Medi-Cal eligible. I noticed, I took a bunch of phone calls yesterday where someone has been used to being on Medi-Cal for years and years and years. They all of a sudden become Medicare eligible, and it shakes up their whole world of Medi-Cal only. The benefits change, the paying sources change, their payment structure has to change. Also, they end up having to contribute sometimes some type of money for their prescription drugs, but their whole world gets turned upside down, especially for the Medis or the dual eligible folks. So Medi-Cal alone isn't within our scope of work, although Medi-Cal and Medicare folks are certainly in our scope of work, is one thing I wanted to remind y'all of.
Awesome. Any other questions for Stephen?
Well, other than that, I'd like to thank everybody for listening to me this morning. And again, if you don't have questions now, you can certainly reach out in the future. I'll go ahead and drop my email in here as well for any future correspondence you may or may not have. I'm happy to help.
Thank you so much, Stephen. That was awesome. And huge thank you to all of our presenters today. There was tons of amazing programs, resources, and services that were shared, and we appreciate you all. This is what this group is for. We're just trying to learn some new information about what's out there in the community. So thank you so much for helping us out with that. And yes, I will be sending out any flyers, PowerPoint slides, like anything from the presenters that you'd like me to share with the group, whether that's resource flyers or the slides or anything. Definitely go ahead and send to me, and I will share it along with the SPN follow-up email. And yeah, so I think that's it for our presentations. Our final section is open communication. As always, looks like we've got a nice 10 minutes about for that. So this is a great time to continue to share any resources or agency updates, any New Year updates, even though we're in February now, any COVID updates, any successes or challenges, or networking or problem solving that you'd want to share during this time. So have at it. Areli, you go first. I see you in the chat.
Thank you. My name is Arely. I'm from Sacred Heart Community Services, and I just have two little updates. The first one is we're already started to do free tax services for low-income families. So if you have any clients that are needing to do their taxes this year, as long as they made under $66,000, they should be able to do the taxes with our program. They will need to make an appointment. I'll put the phone number where they need to call in the chat, but the phone number is 408-715-1951. Just let them know to be patient. It's only one person trying to connect all those calls. So please, if you need assistance, keep calling. We'll make sure to reach to you. The other one is I'm currently the new public benefits program coordinator. And so if you have any clients who need to apply for CalFresh or food stamps, please feel free to send them my way. I'll be more than happy to talk to them, provide them more information. I know the Hispanic community is very afraid due to public charge. So I'm here to support them and provide them the right information so that they're able to benefit from this program if they have the children that meet the criteria. And so I'm here to support them and be able to provide the right information. I will also put my information in the chat. Thank you.
Anyone else have any announcements or any updates, anything they would like to share?
This is Angela for Samaritan House. Our clients can now apply online for financial services, so they have to upload all their documents where they to the office, because our office, we're just open the door, hand them application, but not sit down. And so we do a lot of our case management basically over the phone, asking all those pertinent questions after we've gotten their paperwork. So online is a good way that people can connect to us if they do not want to come out of the house. And our website is SamaritanHouseSanMateo.org.
Hi everyone, my name is Audrey. I'm a youth career advisor with Work to Future. We do have an upcoming job fair tomorrow for anyone who's looking for a job. It's going to be virtual over Zoom, and if anyone that's interested could come with a resume ready, there'll be opportunities to speak to the employers directly after, and hopefully get some people hired. I'll put our flyer in the chat for that. It's coming up tomorrow.
Awesome. Anyone else?
Angela, sorry, a question for the presenters real quick. And the two Angelas and Stephen, do you want me to send your contact information out with the follow-up email? And if so, can you drop whatever that is in the chat box? If not, that's fine. But if so, just put it in the chat box so I can be sure to send it out with the follow-up.
Okay.
Will do.
I did want to say that the Center for Employment Opportunities, so we specifically serve justice-involved individuals who are on probation and parole. But other than that, we are an extremely low barrier program. They do need to be able to work in the United States. They do need to have I-9 documents, but we are accepting referrals, and you can email me directly. I'll drop my information in the chat, but if you have people on your caseload that are looking for work, we are available, and we offer a job that pays every day. So especially good for people who are like hurting from the pandemic and things like that.
Awesome. And then just a friendly reminder for everyone to complete the virtual spin feedback survey. Alexis put it in the chat, but I'll just copy and paste it one more time. So after this meeting, you guys can click ahead and fill out the survey so that we just know what to do next month, or if there's anything that you want to change about the meetings. But if that's it, Alexis, you think we can close out?
Yeah, let's keep it open till 11 if anyone wants to stay on and talk in small groups or whatever. But otherwise, for anyone who has something else to get to or doesn't have any other questions or anything they want to say, thank you for sharing your time with us this morning. And feel free to hop off or stay on. We'll be here till 11. So yes, thanks for sharing your Wednesday with us. We'll see you all next month.
Well, I just wanted to say one more time, thanks again for having us. It was a delight to come out here and talk a little bit about the HiCap and SourceWise programs. So thank you again. It was a delight. I mean, it's been a pleasure joining this group. I'm actually very glad that y'all reached out, or I forget how I got in here, but it's been a huge pleasure just meeting with professionals that are truly trying to help folks out in the community, regardless of the situation that's put in front of us, regardless of how challenging it's been. I know it's been challenging for most, if not everybody here. So thank you for having this group and allowing us this breathing room and just creating the safe space for us to share resources, tools, tips, everything. So thanks again, girls. Appreciate it.
Thank you, Stephen. You're awesome.
Bye.
Yeah, I like SourceWise. It's cool.
Yeah, SourceWise is a great resource.
And Angela, I also liked your presentation too.
Thank you guys for bearing with me.
Oh, of course. And Angela, did you send your message to me as a direct message? Do you want your email address to be given to the group or not?
That's fine.
That's fine.
It's that's the best way to contact me because it's like our office. I'm either running to the door, trying to enter my phone, or email. Email is the best way for me.
Okay, perfect.
It
Just wanted to be sure.
Pops in, and and I see it. So that's fine. They can reach out. I mean, I get a lot of people who either call or they come by our office, and they're needing resources for Santa Clara County. So with the downtown street team, so say for instance, if a family is they're in Palo Alto and they're in need of rental assistance, who is it that I could send them to? Because I used to send them to the Opportunity Center.
It's still them. I can give you, that's
okay.
still them. It's still the best place to send them because for the Emergency Assistance Network, different organizations financially serve different areas. So the Opportunity Center is still the Palo Alto, serves the Palo Alto area. But let me real quick, in the chat, I'll put that Emergency Assistance Network flyer so you can, hold on, will it let me do that?
Yeah, that'd be great.
There, okay. You should, can you see it in the chat and download it to your computer or phone?
Oh yeah, that's a good, wait, let me see.
Let's see.
I should email it to her too. Alexia.
Yeah, no, I can't. I just didn't know if it would work in the chat.
Let's see. I love this handout.
Which?
The one that you just sent. I use that a lot. Good turnout.
Ladies, is that just for the Palo Alto area? Is that for San Jose area as well, that emergency network flyer that you're, I cannot see it though, by the way, but
it says which codes it serves, and so like based off of your client's zip code that they're in, they'll contact that certain network. So like if your client is in 95120, they go to Sacred Heart.
Yeah, it's for all over Santa Clara County.
Yeah.
Okay, can you actually put that in the overall chat for me? Or
oh, I put it in the chat to everyone. If you can't open it, I will.
I can't see it.
Oh, then
I'll email it out.
Maybe you can put it in the SPN email.
Okay, great. Yeah, I was trying to open it.
Yeah, I'll definitely put it in the follow-up email.
Okay.
I think
okay.
I'm not sure if I'm added to the list. I was added through a coworker of mine.
Oh,
so
okay. Can you drop your email address and I'll be sure to CC you?
Most definitely. Thank you.
Yeah, and actually, before you go, let me real quick give you the email address to email to ask to be added to the email list so that you'll get all of these emails in the future. But let me find it. Okay. I'll say that's something we should stick in the chat box every time, huh? For people who aren't on the mailing list.
I wanted to create a website for SPN and then have everyone be able to like create a blurb of their program.
Yeah, that would be super awesome.
Share the flyers and then have website updates.
Having like a resource folder would be like great too. So people could.
How much authority we have over SPN.
I mean, no one else is doing anything for it. I don't know.
I'm like, should we just go all out?
Yeah, why not?
I'll do it.
Okay. I will be sure to CC that. So Kimberly, I will be sure to CC I'll be sure to CC that too, and I copy that email address that I put in the chat box so that if you email that email address with your email and say, you know, I want to be added to SPN, they should add you to the mail list. We don't have access to that, but
Okay.
someone else does.
Okay, cool.
Awesome.
Okay.
Thank you all. We're going to take
Thank
off.
you.
The meeting.
Have a happy rest of your Wednesday.
You too.
Thanks for joining us. Bye.